Bronchitis is the inflammation of the bronchi, the airways that carry oxygen to the lungs. The air, which should glide freely through these passages, instead meets resistance. Narrowed, inflamed, and clogged with mucus. As a result, breathing becomes inefficient, like trying to fill a balloon with a punctured nozzle. Bronchitis presents itself in two forms: acute or chronic. Acute bronchitis is usually triggered by bacteria or viruses, often the same culprits behind the common cold and flu. It typically lasts anywhere from 7 to 21 days and comes with a familiar set of symptoms: coughing, with or without mucus, wheezing, shortness of breath, and sometimes a sore throat or fever. This form of bronchitis usually runs its course and resolves on its own. Until then, patients should stay well hydrated. Fluids help thin out bronchial secretions, get plenty of rest, inhale steam, and if needed, take medications to ease symptoms. Chronic bronchitis, on the other hand, is linked to irritants such as cigarette smoke, pollution, dust, or chemical fumes. This persistent condition can last anywhere from 3 months to 2 consecutive years. Because it stems from ongoing exposure to harmful substances, it almost always involves a mucus-producing cough, along with shortness of breath, wheezing, and frequent fatigue. Even mild exertion, walking up a flight of stairs, for instance, can leave someone breathless. Treatment focuses on eliminating irritants like smoke and air pollutants, incorporating respiratory therapy, using bronchodilators, and in more severe cases, oxygen therapy. If left untreated, chronic bronchitis can lead to serious complications, including chronic obstructive pulmonary disease, COPD, pulmonary hypertension, heart failure, and an increased risk of lung cancer. In the United States, bronchitis cases surge during fall and winter, especially between December and March. Cold weather creates the perfect breeding ground for respiratory viruses, particularly those responsible for acute bronchitis. Dry winter air can also aggravate the airways, further inflaming the bronchi and worsening chronic bronchitis. Suppressing a cough during a bronchitis episode isn't advisable. Coughing is the body's natural way of clearing the airways and expelling excess mucus from inflamed bronchi. Certain herbal teas can also provide relief, as some plants have direct benefits for the respiratory system. Fennel, mallow, garlic, watercress, eucalyptus, and ginger are among the most commonly used. Diet can play a role too. Dairy products and wheat may increase mucus production, so avoiding them during flare-ups might be beneficial. Nutritional supplements like zinc, vitamin A, and vitamin C can be helpful during bronchitis episodes, as they strengthen the immune system, reduce inflammation, and support respiratory health. If breathing becomes significantly difficult, bronchodilators may help. However, if shortness of breath persists, even after using a bronchodilator, seek immediate medical attention.